Okay. Okay. All right. So welcome everyone to Peer September meeting. We're, as many of you may already know, Peer is a multi-issue grassroots organization committed to advocating for issues that impact all Long Islanders, including healthcare, housing, environment, and social justice. And we do that through electoral politics and activist issue-oriented engagements. Peer is a chapter of NYPAN, New York's Progressive Action Network, and which is a statewide organization with over 35 chapters. Peer is also affiliated with Indivisible and Our Revolution. So tonight's forum is co-sponsored by our other grassroots organizations, sister organizations, I should say, East End Action Network, Suffolk Progressives, and Long Island Activists. Long Island Activists is a chapter of NYPAN as well. So what to expect tonight? First of all, we're welcoming to the forum two very impressive Long Island grassroots candidates who are strong advocates for key issues that Peer has been working on for several years. And so before we introduce them, the format for the evening will be, we'll have a couple of announcements, very short ones right up front. We'll have the moderated forum with Catherine Levy and myself doing the moderation. And then we'll have some Q&A for everyone who is attending. And Jerry Maslanka will monitor and she will supervise the Q&A. We ask that you drop in the chat the topic you'd like to ask a question about or your question, and then Jerry will call on you when we get to that. So why do we have these candidates tonight with Peer's meeting, and why is it important? It's really important that we elect these two candidates, Skyler Johnson and Melanie D'Arrigo, because they support all the issues that Peer has been so passionately working on over the years. And we have an opportunity to put in Albany another New York Health Act positive vote, which we want to do, and also down in Congress with Melanie to support single payer. Dylan Rice, who is going to join us tonight, is unable to make it. He's running for Smith Haven Town Council. But just a little background on the candidates. Many of you may remember Melanie joined us for the Invest in Our New York forum that we had earlier in the year. And she's running for Congress in CD3. Melanie's from the South Shore of Long Island, and she was raised in a union household by her grandmother. Melanie is the mother of three and has a master's from the School of Health Professionals at Long Island University. Melanie's worked as a healthcare advocate and strategist ever since receiving that degree. She's also helped found many organizations on Long Island, including Be the Rainbow, and she is a Nassau County delegate for the New York's National Organization for Women. Melanie served as the CD3 representative for the National Nurses United in the fight for Medicare for all. Skyler, joining us tonight, is running for the Assembly in New York too. Skyler is from Mount Sinai, born and raised there. He's a graduate from Suffolk County Community College, and he currently sits on the board of Temple Beth Emeth of Mount Sinai. Skyler, is a leader of the grassroots group Suffolk Progressives. So I'm gonna, before we ask them to give a little more background on themselves and their district, I'm just gonna drop into the chat how you can become a peer member, because we love for people to join the organization. And so if you're not already, please do so. Membership allows you to vote on key issues and endorsements that we make. So we'll close out the meeting with announcements, but at this point, I'd like to turn it over to, we didn't flip a coin, so maybe I'll just start with Melanie. If you want to give us an introduction, then you can popcorn it over to Skyler. Thank you.
Great. Thank you so much, Catherine. Thank you, Pierre, for having me this evening. It's always wonderful to be amongst like-minded folks in this fight. I'll tell you just, quickly, I know I only have about a minute or two, and I'm happy to, get into more policy talk a little bit later. But as Catherine said, I am a Long Island native. I've actually lived in each component of this district, or each area, rather, geographically. CD3 is actually very interesting in the sense that, and unique in the sense that it spans 3 different counties. So it's currently part of northwestern Suffolk County, northern Nassau County, and northeastern Queens. So we run the gamut from more city areas to certainly more rural areas as well, which I think is really exciting. This is a district that has been blue for over 20 years, and it's currently represented by the vice chair of the Problem Solvers Caucus. For those of you who may not be familiar with the Problem Solvers Caucus, the best, I think, comparison is the IDC on the state level. So they're Democrats that caucus with Republicans, and unfortunately, they have blocked critical Democratic legislation and aided in Republican initiatives. I think we deserve bold, fierce Democratic leadership that's going to fight for progressive legislation here. This is an absolutely winnable seat. I did run in the last election. Unfortunately, we could not have really prepared for COVID. That being said, we did really well. We had a very strong showing for a first-time candidate, actually finishing second best in the state for challengers, only second to Jamal Bowman, who of course, bested Elliot Engel in the last election. So we're looking forward to shaking it up and winning the seat to deliver for New Yorkers, this time around. And I welcome your questions, and I'm just so pleased and excited to be here tonight. And Catherine, shall I pop it over to Skyler? Okay.
Thank you. Thank you everyone for having me here. Hi, again, my name is Skyler Johnson. I currently sit on the board of Temple Beth Emeth of Mount Sinai. I also help to run the organization Suffolk Progressives, and I'm the vice chair of outreach for the Brookhaven Town Democratic Committee. I am running for Assembly District 2, which currently contains the towns of Southold, Riverhead, and parts of Brookhaven, including the part where I live in Mount Sinai. So as a lot of you know, I did previously run for state senate in the last cycle, and while I didn't win in my primary, I did get about 3,000 votes and raised over $30,000. So we had a really great showing. Again, I was 19 when I first began to run, so I'm really, really happy with how I did the first time, and I'm happy to be going at it again in a different seat. So we have a really great opportunity here to pick up a seat. Assembly District 2 is an interesting place. It was represented by a Democrat up until, I believe, 2012, and then the seat was flipped, and it's gone through a few different incumbents over the last several years. It's currently represented by Assemblywoman Jody Giglio, who just won her election last year, and unfortunately is already doing damage, where at my school board meeting actually, a group of anti-maskers came to protest, and as they were screaming at the board, including a man telling one of the female members of the board to shut up and telling her to sit down, Assemblywoman Giglio got up, and instead of standing up for the school board, she got up and she gestured to the crowd of anti-maskers, and only to the crowd of anti-maskers, and said, "This is who I represent." And actually her words were the last thing that got the meeting shut down. And I don't like to run negative campaigns, but I do feel the need to bring light to actions like that. That will not be my style of leadership. My style of leadership is not to inflame, it's to inform. And that's the difference here. I'm really, really looking forward to the next about year of campaigning, because we have a really, really great opportunity to flip a seat and get a vote on the New York Health Act, but also get a vote for clean water, and get a vote for fair housing, and get a vote for all the issues that matter and affect our lives every single day. I'm really looking forward to being a leader in Albany, and I'm looking forward to working with all of you to win.
Thank you, Skyler and Melanie. I'm so happy that you're here with us today. You've been great allies in a lot of fights.
Actually, I'm sorry, Catherine, but just before you begin with your questions, I just want to underscore, well, first of all, everyone has seen how wonderful these 2 candidates are, but I just want to underscore that one of the reasons we're here tonight with them is because they really grew out of the grassroots organization and the grassroots groups that have erupted on Long Island over the last, 5 or 6 years. They've run, but they've not served. And so that I just wanted to clarify that those were reasons why we really wanted to, put them forward and help their campaigns. So please, back to Catherine.
Yeah, no, I want to underscore that. I feel that we're talking to our own fellow activists who are going to be candidates and great public office holders. One of the things that Pierre has been focusing on for the past 5 years since our founding has been single payer healthcare, whether it's Medicare for all or the New York Health Act. And I have loved in both of your campaigns how much you've centered single payer healthcare and how knowledgeable both of you are about it. So we're going to begin with a discussion of that. I'm going to start with a question that I'm sure both of you could talk about at some length, so be somewhat brief. What do you think are the strongest arguments for single payer health care, either Medicare for all or the New York Health Act? And I'll begin with Melanie. You're mute.
There we go. Yep, I'm ready. Thank you so much. You know, as I believe Catherine mentioned, I spent my career as an allied health professional. I've been working with patients and families and organizations, developing preventive health strategies so folks could live healthier lives. So this is a cornerstone of my campaign. It's something that's near and dear to my heart. I think, like many of you on the call, I truly believe that healthcare is a human right. It shouldn't be a privilege, which is why I talk about Medicare for all and single payer all the time. Some of the benefits of it, I mean, there's frankly so many, and where to start? Let's start first and foremost. You know, there was a Yale study that I'm sure some of you are familiar with that came out about 1.5 years ago that indicated a universal healthcare system would save us money about $450 billion per year than our current system. And compared to a public option, which I know, you know, there's some support for, single payer is actually $600 billion cheaper, which is astounding. You know, I think when we look at healthcare and we look at the issues and look at solutions, if we were a for-profit business, this would be heralded as a resounding success, and businesses would switch tracks to this because it's a money saver, and it also saves lives. Universal healthcare would be, it's estimated to save 68,000 lives per year. If that's not enough of a reason to switch and ensure that no one has to worry and choose between, you know, paying their rent or buying their medicine or paying their groceries and going to the doctor, the cost savings alone is enough to make us switch. The other thing I'd like to mention and touch upon that I don't think we touch upon enough is the impact on small businesses. Currently, small businesses can't even get insurance. They reach out to insurance brokers and they're turned out flat out because they don't want to, they're too risky, quote unquote. And, you know, this would allow small businesses to provide healthcare and to their employees. It would also allow us to develop further innovation and encourage entrepreneurship. Many folks stay tied to a job, oftentimes sacrificing wages because they are tied to their healthcare. And that just shouldn't be the case. We are the only industrialized country in the entire world that does not have universal health care, the only country. And that to me is just so unbelievably unacceptable. That's something we don't talk about enough. You know, the amount of people who are suffering from medical debt because of, you know, health bills, it's something that we all need to pay more attention to. It's the most popular GoFundMe out there. There are millions and millions of dollars in GoFundMes to pay for healthcare expenses because it is unaffordable. And every single year, medical trend continues to go up, and CEOs' bonuses continue to go up. There is an exact correlation. There is no reason we need to pay someone money to deny us healthcare. So, you know, this is something that I try to do a lot of education about. For those of you that follow me on social media, you'll see if you don't, you want to learn more, please go ahead and follow. We try to make it as concise and informative as possible and shareable content so that we can help educate others. I frankly think there's not enough talk about the nuance here of healthcare. And I think if more people knew, we would get more people on board.
So I presume, Skyler, you agree with a lot of that, but why don't you talk specifically about the New York Health Act? Because I do think, and I presume you agree, that we have a chance to pass the first single payer bill in the country here, particularly with you in the Assembly. So you want to talk in particular about the strengths of the New York Health Act?
I would love to, and you're right. I'll keep it brief because I could go on forever about this. But I just want to say this. First of all, imagine that you walk into a convenience store and you pick up a candy bar and go up to the cashier and you say, "I'd like this, please." And they say, "Okay, that'll be $75,000." And you say, I can't afford that. That's ridiculous. That's a made up price. And they go, "No, no, no, you're right. So if you have our discount card, it'll only cost you $12,000 today." And you say, "Well, I guess that's reasonable," and you buy it. That would never happen. That would never happen in any stretch of the imagination, but that's what happens with the essential product that is medicine, and it is absolutely ludicrous. We currently have, before the pandemic, about 1 million New Yorkers who are not even insured, and we have millions more who are on insurance plans that are filled with holes, that plans that are not comprehensive, that leave them struggling. I will share something personal with you. Just a couple months ago, I take medicine that helps with my throat, that allows me to eat properly without getting sick. I randomly got a letter in the mail from my insurance company a couple months ago telling me that medicine was not essential. That medicine helps to stop white blood cells from attacking my throat, and my insurance company decided that I did not need that medicine anymore. They were going to charge me as much as they potentially could if I wanted to keep that medicine, because some random group of people in a room decided that medicine was not essential. Every single year, my father has to fight with our insurance company because they decide that the medicine that stops him from having seizures is not a necessary medicine. What kind of ridiculous society is this, where we are stuck with these companies that are making life and death decisions over us based on their profits? Healthcare is a human right and should not be a for-profit system. They've actually spoken to former executives in healthcare companies who have admitted that they have people whose entire jobs are to go through files and to try to find reasons to deny coverage. One person talked about how they regularly denied women coverage because they did not previously report that they had had yeast infections, and they classified that as a pre-existing conditions. Our system is fundamentally broken and fundamentally corrupt right now. Changing to New York Health Act would save so many lives. I don't even think it's truly countable, because it's not just about the lives that are immediately saved by people going to the doctor right away. It's about the fact that if we have comprehensive health insurance for every person in New York, that means comprehensive preventative care. It means comprehensive care on every level, and it means saving lives throughout the state. Now, it's funny because we always hear a lot of arguments against a single payer health system. These arguments largely don't make sense. So a while ago, I was on NPR, and I got into an argument with a Republican assemblyman who no longer has his seat, but he made up numbers about how it will triple the state's budget. And that's, first of all, completely inaccurate, but that's besides the point. New York Health Act would save us money, because New York Health Act is a tiered system of payment, which means that the average person, that the vast majority of the state would be saving money with their health insurance, because currently health insurance rates are astronomical. They're largely whatever the insurance company wants to be charging you. So changing to New York Health Act would save a lot of money. And here's a good reason why, and this is something that I like to emphasize. Medicine is actually not that expensive. Medicine prices are just made up. For example, an IV bag costs under $1 to make. Most hospitals charge about $150 on your bill. Tylenol is not an expensive medicine to produce. Most hospitals charge about $20 a pill for that when you go to the hospital. So part of what New York Health Act does, it allows the state to negotiate all of this. It allows the state to negotiate drug prices and make sure that we're actually paying reasonable prices. So when you look at medicine, we're making kind of the false assumption that you're going to be paying whatever you see on your bill. That is incorrect. The state can negotiate down those prices to make sure that they are not paying those astronomical fictionalized prices. And it is one of the most critical aspects of the bill, actually, because it will save a ton of money for nearly every person in New York State. Now, when I've spoken to people, especially in my last campaign, something that I noted is that people pushed against the New York Health Act not because they disagreed with it, but because they didn't really know what it was. A lot of people would say to me, well, I already have really good health insurance, so I don't think I want this because I don't want to get worse health insurance. One of the best things about New York Health Act is that it's specifically designed to make sure that no one ends up on a worse health insurance plan. And in fact, it guarantees that everyone would get a better health insurance plan because it takes whatever aspects of existing health insurances there already are and covers them. It means vision and dental for every person in New York State. It means full coverage. It means experimental treatment for every person in New York State. And that's one of the things that I like to emphasize to people. Your health insurance is good right now, but just wait until something catastrophic goes wrong and you're applying for treatment and your health insurance company goes, we can't say that this is necessary, so you're going to have to pay for it. Your health insurance is only as good as the insurance company decides it is. And that's part of the reason that New York Health Act is so critical and such a necessary bill. The other thing is too, is that a lot of times when I speak to people, especially people who are now retired, they say, well, we already negotiated my health insurance. It's here to stay. It's not like I can lose my job. And something I like to point out is maybe you can't, but you may have kids or grandkids that are about to turn 26 years old, and they're going to have no health insurance unless they happen to find a job that covers it. Our system currently tells people that health insurance is not essential. We treat health insurance as if it's a commodity and not like it's something that's necessary to survive. We cannot continue that discussion that way. We need to first of all acknowledge, and Pierre has done a great job of this, that healthcare is not only a human right, but it's one of the only ways it's the only way to a healthy society. We need to constantly be emphasizing that point in the discussion of New York Health Act and Medicare for All. There's so much more here, and I don't want to take up too much of your time just with this one question, because I have a lot that I could say here. But when I talk about New York Health Act, I emphasize the fact that it would save lives, it would save money, and it would change the landscape. And the last thing I do want to mention here, because this is something that gets left out of the discussion, New York Health Act doesn't cover every New York Health Act doesn't cover every citizen of New York State. It covers every resident of New York State. And that is a very, very critical distinction, because what that means is that if someone comes here and they are an undocumented immigrant, they will be fully covered. Something that I hear a lot, and it's an argument that is really hurtful actually, is I hear people try to go, well, those undocumented immigrants, they can go to the hospital and get free care, so why should this matter to them? That argument is completely false, because that argument only argues that someone who is undocumented could walk into the ER and not be denied service. As I said already, healthcare is more than just emergency care. It's preventative, it's checkup, it's dental, it's vision. It is everything that encompasses keeping yourself healthy. So New York Health Act is not just a healthcare issue, it's an immigration issue. It's a welfare issue. It is such an overarching issue that I cannot even begin to emphasize its importance. I'll yield it back to you now, but I'm really happy that Pierre spent so much time focusing on New York Health Act and Medicare for All.
Well, I mean, I think you're both showing what strong advocates that you would be for single payer health care in your legislative bodies. What do you think is the difficulty that you had and are going to have in your districts with various groups, including unions who have been strangely resistant? Some unions have been strangely resistant to single payer health care. And how do you propose to try to deal with that? And are there any things you would do differently this time to deal with it? This is something that's a frequent topic of discussion here among the people in Pierre about how to take a different tack to approach the criticisms of single payer healthcare, and particularly among unions whom we would think would be our allies in the fight. Melanie, I'll have you answer that first, and I'll go to Skyler.
Yes. So I think, part of the difficulty for grassroots candidates and first-time candidates, and, I'm speak for myself, I assume, Skyler had I would assume some similar issues. You're trying to build support and make headway everywhere you can, but, you often get pushed out as a first-time candidate or a non-establishment candidate, and it can be really hard to make any headway initially. So I know, something that I'm doing differently this time around, because I recently ran, we have a lot of initial support. We already have 10 endorsements from some major organizations, and we're really pushing them to help us make introductions, which, that already have existing relationships. So that's a little bit easier this time. Another area that I'm really looking to focus on, because I think I don't know that it's been done. I really want to meet with the small business associations and do a presentation on Medicare for All and how it could impact their bottom line, because I think there is this myth and certainly quite a bit of misinformation that it would hurt their businesses, when in fact it will have the opposite effect. correct. And I think we can get a lot more businesses on board if they have the information. I think with something as complex as healthcare, which frankly, the average person doesn't really understand our current healthcare system, there's opportunity to create distrust and misinformation, and it scares people. So we've seen this. There's a ton of fear mongering going on. And so, our quest in my last run, which I think we did really, really well, is really bring the facts and educate people and come with the receipts. For me, because particularly on Long Island, I think we've all seen sometimes buzzwords can scare off folks, right? So instead of, coming in, blazing with Medicare for all, I would talk to folks about healthcare policy. Here's the problem. Here's the solution. And I wouldn't say any of the names, right? Any of these policy names that they've heard of that they may already have a preconceived fear about. And I would get folks saying, well, that makes absolute sense. And then I would say, well, that's Medicare for all. And you'd see almost like such a look of shock and surprise because that's not what they were told. Folks like us who show up and advocate and take the time to learn are really the minority. The overwhelming majority of folks, they don't have time to read the ins and outs and understand it. So, our job is to, package it as in the most digestible way possible so that we can feed them the right information. I have found, and I said, I've had a lot of success with this. When we're able to really present the facts, we have flipped people on board. And it's really been astounding. Even people who have come to me and said, well, I don't agree with you on Medicare for all, but I appreciate, your willingness to step up and run for your community. And then we have a conversation and, they're supporting it by the end. So I think that's part of the solution. But I do think, as progressives, we need to build these stronger relationships. I think unions in particular, they are a tough nut to crack. And, they historically have been very aligned with incumbents, mostly Democratic incumbents, but not always. I've been told, straight up that my policies are more reflective of their union values, but they can't support me because the current incumbent won't call them back if they go against him in a primary. So there's a lot of politics at play. One strategy that I'm hoping to employ, and it's something that we're just really in our infancy, so I'm going to throw this out and do an ask. If anyone is a union member here and is willing to organize some fellow union member meetings, we may not get in with leadership. I think it's going to unfortunately take several years to have, those real solid relationships that we need, but we can start just like we do in the grassroots, start with the people and start bringing people in and providing them the information they need. Before I pass it off to Skyler, I just want to go back very quickly to the first question when Skyler was talking a lot about cost. This is something I actually recently learned, and I just want to make sure that everybody is aware of it. The insurance business model has evolved into a very sophisticated revenue stream over the last, several years. And this is astounding to me. Let's take, say, for example, Cigna. Cigna develops different insurance plans for all of their corporate clients, right? So JP Morgan has maybe 2 or 3 offerings. Goldman Sachs has maybe 2 or 3 offerings. McCann has 2 or 3 offerings. And each of those offerings is negotiated differently. So it doesn't matter that Goldman Sachs and JP Morgan and McCann all have Cigna. Each plan is charged a different amount of money for that Tylenol. Even if there are 2 different plans at Goldman Sachs, Tylenol is charged differently per plan, even though they're both under the Cigna umbrella. And in some cases, it is thousands of dollars. More troubling, in some cases, it's more money than you would pay if you had no insurance at all. And that is something that's a really crucial point to make, because I think when you have those conversations with people, that is something that it does not make any sense. So insurance is not healthcare, right? It is a revenue stream, and they are gaming the system, and they are winning at the expense of all of us.
I just want to, that was terrific, Melanie. I think you probably have everybody on the, both of you have everybody on the call fired up about getting you into office, but I just want to ask the same question to Skyler, particularly focused on the unions, because it's been a point of frustration for us who have been working for the New York Health Act, and I'm sure for you, about how to break through with the unions. Do you have any ideas about that? And I know you do, so.
Yes, yeah, absolutely. So speaking specifically to unions first, something that's interesting when talking to unions is that they're largely not against a single payer system. They just don't fully understand how it would benefit them. And one of my favorite conversations, actually, I was on a virtual forum at one point during the campaign last year, and we were speaking, and it was someone who was a union member, but he had retired. His plan was already negotiated and done. And he was pretty much arguing with me, and he was going, well, how does this benefit me? We spend all our, I negotiated already. Well, basically, why should we get a single payer health plan now that I've negotiated this? Because that means that I wasted those resources. And I'm going back and forth with him, and I'm thinking, all right, I've done everything that I can. It doesn't look like I've been able to win him over. And he didn't seem happy when we ended the call. The minute that the call ended, I got a $50 donation from him. And it was conversations like that I really loved, because people were really, really willing to listen. When we go to unions, it cannot be the strategy of, we cannot unfortunately use the strategy of, oh, it's better for everyone. When I go to union people and I explain why why the New York Health Act is so good for them, I generally frame it through this argument. I say, hey, the entire concept of a union is based on the idea of collective bargaining. You only have so much influence that you can exert for your clients, for your businesses. So if we take healthcare off the table, that's just more power in your pocket. And what I mean by that is that when people are getting hired, when people are trying to negotiate their healthcare plans, unions tend to have to use a lot of their clout on the healthcare section to try to negotiate by their healthcare plans. If we make that a non-issue, if that becomes something that someone has to begin with, then unions do not have to negotiate that, and they can use that negotiating power to get better conditions for their workers, to get better pay for their workers, to get better hours. It is something that strongly benefits unions because they no longer have to worry about that issue. The other thing is that when people are unionizing, people unionize for a lot of reasons, but it's not just because of healthcare. It's because of all these conditions that they need the strength to push back against when employers aren't doing them justice. So again, when we take the healthcare issue off the table, it gives them all that much power, because I can tell you right now, there's several hospitals and medical institutions in my area that have been attempting to unionize. They will have to use a lot of their power on their healthcare plans. If we take that off the table, they can use that on everything else. So that is always my argument to unions. We are going to give you more power by passing the New York Health Act. It will strongly benefit you. The other thing is that unions are strong, but there's a lot of union busting companies. Their powers only go so far, and it ties back into this issue of putting the power back into their hands. If everyone has healthcare, it's not just one thing less that they have to worry about. It means that they're working with members who are happier and healthier, if that makes sense. It really, really benefits them overall. And that is the argument that I always give to them. And I've seen that argument work, because when you frame it as your collective bargaining skills are raised, they are much, much happier to oblige. Now, when framing it to the general public, Melanie, you were talking about how you don't always mention, Medicare for all or single payer healthcare at the beginning. I got to say, one of the biggest both advantages and disadvantages of New York Health Act is the fact that no one knows what the hell it is. When I'm talking to people, I could go, have you heard of the New York Health Act? And 9 times out of 10, people have no idea what I'm talking about. So I get to be the first one to explain to them. And I love that. If you don't notice, I do like to talk a lot. So it is something that that benefits me. But when we're able to educate people on New York Health Act before the other side's propaganda starts flooding in, it really changes mindsets. I have won over Democrats that consider themselves conservative Democrats on this issue. I've gotten Republicans to be like, oh yeah, that sounds good. In fact, actually, you probably all know what Turning Point USA is, but if you don't, it's a far-right organization. They were on my college campus yesterday, and I got into an hour-long conversation with them, and I got one of their members to even admit that, oh yeah, well, if you have health insurance, it really should be affordable, and they shouldn't be price gouging. And I went, but they're not. So if this system's not working, then we need to go to a single payer health system. And I could see him trying to figure out a way to disagree with me, and he couldn't. And we ended up moving on because he no longer was as interested in that part of the conversation. It's really neat actually seeing kind of that moment where it clicks with people, where it makes sense to them, because everyone has struggled with something like this at a point in their lives. There's very few people that I know that at some point haven't said something on the lines of oh, I'm not feeling well, but I don't need to go to the doctor. They're just going to charge me $50 to look at me, or who has avoided going to the dentist because of the fear of expensive work, or who's wearing outdated prescription glasses or contacts because they know it's going to cost them too much to renew those. It's a constant and pervasive problem throughout our society, and it gets corrected with this. So when we frame it in the more individual, I'm sorry, I can't speak. When we frame it in the more individual, I can't say this word. When we frame it from the individual perspective, it really helps. And I like to both talk about that. Here's the big picture, but here's how it benefits you and your family. And people do respond to that because, again, as I said before, I've spoken to people who were against the idea of a single payer system. But when I framed it as, this isn't just about you directly, it's your grandkids. Your grandkids aren't going to have health insurance unless they find a job that covers them in a few years. They're much, much more likely to support it. And I do want to end with this, just a brief history here. And I won't go on too long with this. In the 1920s, there was a collective of mostly teachers, and they were having trouble paying for medicine. And hospital administration was getting frustrated because they were losing money because people had nothing to pay. So hospital administration worked together with these teachers, and they created an organization that would allow them to save money. That organization became known as Blue Cross. Around the same time, there was a group of laborers that were really, really struggling with health issues. And same problem, they couldn't really afford their health care, and they were working in the mines, they were working in the fields. They were struggling with a lot of health problems that are associated with those jobs. So they came together and they formed a collective. That became known as Blue Shield. And eventually Blue Cross Blue Shield, unfortunately, strayed away from the people that created it and became all about those administrative goals of earning money. But here's kind of my point here. Those organizations started as a collective of workers, and they just show the power that come when people are really joining together on this level. And that's why I love grassroots organizing. Unfortunately, Blue Cross Blue Shield betrayed what it was originally meant to do and started to become about greed. But that's why when we work together, we can really create a system that's going to work. We really can build a system that's going to benefit everyone. And when it's a system with accountability, such as a government-run system, we really have an opportunity to build something great. I am fully optimistic that we are going to pass New York Health Act. I'm really, really excited to work to do that. And I'm really excited about what it's going to mean for the state.
So my last question on healthcare, although the two of you could clearly talk about it all evening, not surprising. I thought, and many of us thought when we started on this terrible journey of the COVID crisis, that it would change people's thinking fundamentally about universal healthcare. I'm not sure that has quite happened. And I wonder if both of you briefly could talk about any experience you've had of discussing COVID in relation to single payer healthcare with voters and people who may be skeptical. Melanie?
Yes. My hope was that it would fast track universal healthcare as well. And I'm continually disappointed and dismayed to see that it hasn't. But I will say that I have had a lot of positive movement with self-proclaimed conservative Democrats and even some Republicans who were adamantly against single payer healthcare pre-COVID that now have been enlightened and are in favor of it. And I think, unfortunately, and this is the case with most issues, folks are not bought in until it directly impacts them. And I think when families felt the frightening effects of potentially losing their jobs or, reducing income and what that would mean, or maybe for the first time in their lives, we're facing the uncertainty of a job market. It made them rethink our healthcare system. I also think that there's we have this uniquely American value system where we think we're the best, but we don't have a lot of understanding about what's happening in other countries. I'm constantly hammering the point that, we're the only industrialized country that does not have universal health care. And that's very impactful as well. So I have seen movement. It's something that we're definitely talking about on the campaign trail. I do think, it has moved the needle. I mean, the most recent stats I've seen, I think it's, I don't want to misspeak, but I want to say it's something like 67% of voters, I think it's 87% of Democrats now support universal health care. That's incredible. I know the change isn't happening at the rate in which we need it to, and we do need it to happen immediately. We had over 100 co-sponsors to Medicare for All this year when it was introduced. I'm very excited to be, 101, come 2 years, I guess, after I win this election. But we need to just keep talking about it. We need to normalize it. And I think just highlight as much as possible how backwards our system is, right? We have this sense of believing what we believe because we're told to believe it. It's hard to shake people out of what they have always known. And I do feel, the road ahead is not going to be easy, but there is a path to continue to bring people on, because I did it before COVID, right? So I know it can happen. And now we do unfortunately have to tap into like the emotional vulnerability of it. And I think we can pull more folks over.
Skyler, have you seen any shift in relation to COVID in the dialogue about single payer healthcare?
Yes, and it's not where I thought it would initially be, because I thought that I was hopeful that initially it would be with the argument that, well, we saw how people delaying medical care could be catastrophic, but that's not actually the part of the issue that people really focused on. And the part of the argument that I've been making is this pandemic showed a big part of why tying healthcare to employers is disastrous. And people have responded to that because there are hundreds of thousands of people throughout this nation who were adamantly against any kind of single payer healthcare system because they had healthcare and they had steady jobs, they had safe jobs, there was nothing they had to worry about. And then they woke up one day and that safety net was gone. That has changed the conversation a lot because all of a sudden people were thrust into the reality that their lives are not as stable in that mean that they thought. That's how I've been framing this conversation a lot. We saw so many people lose health insurance. We read a lot of those stories. We saw a lot of the really disastrous consequences of people suddenly losing their health care. Now, imagine if it wasn't an issue. Imagine if we had seen an alternate universe version of this pandemic where COVID shows up in the United States, things shut down, but every single person has health care. How many lives do you think we would have saved just in the pandemic, first of all? Because how many people would have started to feel sick and not thought, oh, geez, I can't afford to bankrupt myself going to the hospital? We would have saved so many lives if we had had a single payer health system at the beginning of this pandemic. But even if that's not the thing that's going to convince people, talking to people in terms of their own employment is the fact that health insurance can be gone on a dime, that it is not certain, and that any change can really rip their entire world apart in a way. And that brings it back to the argument of what I was saying in a previous answer. When I talk to people who are retired, who, their insurance is not going anywhere because it's not directly tied to their employment anymore. The thing that I bring up is the fact that their insurance is stable because they're in good health right now, or because the health insurance company has decided that whatever treatment they need right now is fine for them to pursue. There could come a day, and there very well might, where their insurance company decides that their treatment is no longer necessary, decides that they're deeming a treatment experimental that could be the thing that saves their lives. No, none of our health insurance is actually stable. It is at the whims of a group of people sitting in a room doing who knows what. And that is what I have emphasized through this. And that part of the conversation has really come to light in the last year or so, because people saw that firsthand. It was no longer just a thought experiment. It was reality, because everyone knows someone who lost their job, who lost their livelihood. We know all these businesses who have shut down and not reopened. We know all these companies who have not rehired all their employees because of the catastrophic loss of business from last year. We really have an opportunity to change the conversation here, and that is what I am trying to do. Even if just in my little bubble of the world. I also want to highlight what Melanie was saying too about how we're behind every industrialized nation. It's funny because one of the things that conservatives love to tout is freedom, and that's been their argument through this entire thing. The United States is not number one in freedom. In fact, actually, when organizations rate freedom scores, the United States generally doesn't even make the top 10. And that's because we lack things like single-payer healthcare. There's no freedom there's no freedom in being tied to corporate masters and whatever they decide your health insurance should be. The United States is actually much lower in freedom than a lot of these countries that have these social safety nets. That is something I emphasize to people, and that while it's not necessarily the point that breaks through, I do like to bring that up. The fact that we can look at it from that angle too. This is a point of freedom. Yes, I know that the GOP will argue until they're blue in the face that, oh, they're taking away your freedom because they're making you get this government plan. Are we taking away your freedom by making you drive on government roads, or would you rather your roads be sponsored by Walmart and Target? Are we taking away your freedom by having public schools? Are we taking away your freedom through all of these social programs that you already take advantage of every day? And that is something I like to make clear. I do just want to say one of my favorite arguments when I'm discussing single payer healthcare too, is that, and it's something I've brought up actually more during the pandemic because I feel like it has made people think a lot more, is I say this: when you call the police or when you reach out to the fire department, do you give them the check before or after they're done? If your house is burning and the fire department puts it out, where do you pay the fee? And that really gets people thinking too, because it actually reframes what New York Health Act actually is and what its potential to be is. But I don't want to stray too far into that again, because I already said a lot on that. But I do just want to say, to reemphasize, the biggest change that I have seen during the pandemic is the fact that people are actually rethinking the idea that health insurance should not be directly tied to employment.
Good point. And I think Catherine's going to ask some questions about some other issues. Yeah.
Great, thank you, Catherine, and thank you both. I just want to underscore a few things that came out in the previous session, or the talk about healthcare. I can't remember the source, but it's a reputable source, said that 200,000 lives would have been saved in the COVID crisis if we had a single payer system. And that number was quoted, I believe, in the spring, so it probably would be higher. So clearly, healthcare is a key issue in your campaigns. We're going to pivot now, and I'd like each of you to tell me what are the other, let's say, top 2 or 3 issues that are going to be the centerpiece of your campaign. Perhaps you could just enumerate them first, and then also, and then we'll discuss them in more detail. And at the same time, tell us what issues are most on voters' minds. So the point is to find out from you the issues that are the centerpiece of your campaign and what are you hearing from voters. I'm also going to ask you to be brief because we have a lot of more questions coming at you over the course of this evening. So let's start with Melanie, with just enumerate the issues and then we'll go and have a discussion.
Yes, thank you so much, Catherine. For me, getting corporate money out of politics is always at the very top of the list, because I truly believe that is where legislation goes to die. It's the biggest barrier to change. And I think if we eliminate it, and we can get public financing, like what is in the initial, that of course is in the initial For the People Act piece of legislation, which is unfortunately looking like it's not going anywhere. I think those 2 pieces will allow us to elect actual fighters for people, folks like Skyler. I saw Joe Sackman, who ran for assembly, on this call as well. We need to take the power out of the multi-millionaires and billionaires. Most of Congress is comprised of millionaires. So it's really no surprise that they are writing laws from their own perspective that benefit billionaires, millionaires, and their corporate donors. And unfortunately, we see this over and over and over again. I'm not going to go back to Medicare for all, but you look at something like that over the last 20 years, $10 billion was spent on lobbying, against healthcare for our citizens. I mean, it's a really broken system. And, you know, I've written some legislation that I'd love to implement, and we'll talk about that in depth a little bit more, but that is the crux of I think all of our issues. I'm also a very Green New Deal candidate, policies that will help us realize the Green New Deal, which is, to me, a really important piece of legislation that we're discussing. A lot of folks know it to be, the resolution written to combat climate change, but that's really only a piece of it. I look at it also as a piece of legislation that would reduce inequity and give people an opportunity to live a thriving life, right? It's a jobs creator, which would also provide good healthcare. So that's very important to my campaign as well. I never thought in my lifetime that we would be in such a precarious moment as a country where our democracy feels like it's hanging by threads, but that's what it feels like to me. This moment feels very heavy. And voting rights is something that I deeply care about, and it's something that is on voters' mind, not just here in our district, but all across the country. That is something that's really important, that we need to make sure it is a do or die scenario. And I also, pretty much any type of legislation that centers human rights and civil rights, I push very hard for. I am involved with some LGBTQ groups here locally, and there's so much more, and there's so much discrimination against the LGBTQ community that we need to change. So that's a piece of my campaign as well. Ultimately, I am a pro-peace, people-first candidate that approaches every piece of legislation from a moral stance as well as a people first stance. So I'm happy to talk a little bit more, but I'll pass it off to Skyler now.
Thank you so much. So I have a lot of issues that really matter to me. As a lot of you know, I pride myself on always running policy-based campaigns. I always think that policy should be at the forefront of any candidate. I hate when candidates don't have any actual issues to run on, and that's something that it matters a lot to me. So besides healthcare, I would say my other top issues are housing, education, and the environment. So I want to start with the environment here. The environment comes into play in several different ways. So first of all, we of course want to fight against the effects of climate change. We live on an island. We all know the importance of that. We just saw directly how important it is when we saw New York City in underwater. We are seeing how catastrophic the effects of climate change are and are going to continue to be. And we need to be putting in place every program that we can to fight that. There's some drastic measures we can take, and then there's some smaller measures that we could take. I've advocated for a whole bunch of measures: better corporate responsibility, better regulations, but also things such as making our entire public transit fleet electric. Things like that really reduces the carbon emissions of New York State, and it could really, really benefit our environment. And in that same measure, that's why environment so largely ties into transportation, because part of what we have to do is increase public transportation on Long Island. I'm sure we all know that Long Island was very intentionally designed to be inaccessible. We can change that, and if we increase our public transportation, if we build that system up, it means less cars on the road. It means less of an environmental impact, and it also changes lives because it allows people to get to and from places. I was just actually discussing, and I won't go too far into this, how you can be too poor to work because of issues such as public transportation, because of the lack of public transportation. So public transportation is such an important issue because it benefits our environment, but it also benefits people. So with the environment, the other side of this, besides directly climate change, is Long Island's water quality. Long Island's water quality is not very good. I cannot tell you how many voters I have spoken to that when I bring this up, say something along the lines of, "Oh yeah, I have not taken a sip of tap water in years." No one will drink our water because it is not good. I cannot tell. I had one woman in Riverhead who always has a Brita filter or has bottled water because her water always tastes off or sometimes even looks off. It is toxic. At one point in 2019, there was an estimate that was put out that 70% of Brookhaven's wells had been contaminated with the chemical 1,4-dioxane, which is a known carcinogen. We have constant water quality issues on the island, and part of the problem is that we don't invest in our infrastructure. We have seen some movement on that in recent years where they've said that they're going to invest, I believe, $100 million in Suffolk's infrastructure. But to be quite honest, I feel like that's been said for years. I feel like they're always saying that they're going to do something out here, and it's never done. We never see any real movement on that. So that's something I really want to focus on. I want to make sure that we get the entire county really great water quality, because it is unacceptable right now, our levels. So then when it comes to housing, plain and simple, we need to fight for affordable housing. We need to fight for fair housing. Part of the issue, and part of the reason I do sometimes stay away from the word affordable housing, is because right now the HUD definition of affordable housing is absolutely ludicrous for a place in New York. We don't see families getting into these so-called affordable housing units. We see people really struggling just to get by on the island. You know, you're based on the South Fork. You all know how bad the trade parade is. You know how bad the housing crisis is on Long Island. And we're seeing more luxury developments. We're not seeing multi-house zoning, which again ties back into the environmental issue, because sewers allow for multi-development zoning. We really can make a big difference here with housing. And right now it is nearly impossible to find affordable housing on the island. Housing prices are ludicrous. I was actually interviewed by Newsday about this. I was part of a discussion on this a little while back. People are not staying here. People want to leave because they cannot afford to live here. I cannot tell you how many people my age I know that will not stay on the island once they either graduate school or once they can find a place to leave because of the lack of affordability. I cannot tell you how many people I know who have lived here for their entire lives and are now in their 60s or 70s and are saying, I just can't afford it anymore. It is an absolutely ridiculous situation. And yes, Melanie, I'm really glad you pointed that out in the chat. I love to quote that number. It has been estimated that it would only take $20 billion to end homelessness in the United States. That means that if we cut about 1% from the military budget, we could, that's what we're right on top of it right there. We could end homelessness in the United States. We have more vacant homes than there are homeless people. That's something I previously advocated for, the repurposing of those units to get the people who are currently sleeping on the streets into units. So I try to make housing, healthcare, and education my top issues. Just briefly on education is currently really unequal, both K through 12 and in college. Part of the problem is that we currently base education on property taxes. That doesn't make any sense as a system, because that means that your zip code entirely determines how high quality your education will be. It means that it determines if your teachers are getting paid fairly or if they have to work a second job as soon as they get off school to make ends meet. It determines if you have textbooks that were written last year or in the 1980s. It determines if you have proper access to technology. It can determine the entire quality of your education. We refer to education as a great equalizer, but it's not. It's when you have one school district that's barely struggling to get by and another school district that's being fined for a surplus in their budget, you are not seeing fair education. So I previously advocated to change the way that we tax schools and make it a blanket tier tax across the state instead of taxing it as property, because that really creates major issues. I've also advocated for universal pre-K, because that would change a lot of lives. It would save people thousands and thousands of childcare costs. It would allow people to work if they so chose to. It could really change a lot of lives, and it would mean that people who have to work and don't have that choice, again, could save on childcare and could be pitting their children into situations that could be trusted. The last thing I'll say on this is I am an advocate for free universal college, especially free SUNY and free SUNY and CUNY schools. That's something that, fun fact, SUNY and CUNY schools were actually built to be free. They were designed to be tuition free. And then unfortunately, people got greedy and they made it more of a for-profit organization. And it does not make any sense right now, the skyrocketing cost of tuition. We really can make SUNY and CUNY schools free for everyone. It would benefit so many people. And along that same lines, cancel student loan debt, which would be the biggest stimulus to our economy in United States history. When we implement all these plans, we will be changing lives. We will be improving our economy. We will be really making a huge difference. We will really be making a huge difference to people throughout New York State and throughout the United States. And Catherine, the other part of your question is what's on voters' minds? It's all of these issues to one degree or another. I cannot tell you how often the environment gets brought up. I cannot tell you how often the issues such as the trade parade or the housing issue, crisis gets brought up. All of these issues are on people's minds, and sometimes they don't even know how to directly formulate them because no one ever bothers to ask them what matters to them. That is always the first thing I say in calls. I always ask them exactly what issues are most important to them, and I make sure to go over it with them and emphasize the solutions. Those are my top issues. I could talk quite literally forever on these. I will pass it back to Catherine now, though, because otherwise I will not stop talking.
Thank you, Skyler, and thank you, Melanie. And, I really like how both of you have emphasized the intersectionality of all these issues. You can't have, money in politics and be able to have like really decent healthcare because all of the money is fighting against what is really for the benefit of the greater majority of citizens. So that's wonderful that you emphasize that. And also both of you have brought up the question of language in a campaign and how we can get beyond the labels so that we are reaching people who have at the heart of their everyday struggles issues that we support through legislation that will make their lives much easier without having to say, well, you're liberal, progressive, or conservative. We want to try to get beyond those labels. So with that in mind, Skyler just said what's on voters' minds when he talks to them. Melanie, just if you want to just say a few moments what are on your voters' minds, and then we'll go to the next question.
Yeah, absolutely. So, voting rights is something that I'm hearing a lot about. The filibuster I'm hearing, and ending the filibuster I'm hearing quite a bit about, which is great. I'm sort of surprised to hear that. I'm hearing quite a bit, of course, about reproductive rights. I think, many people tend to follow the news cycles. So, when something happens, I'm hearing it on the phone each and every day. I do think people are very concerned about the planet and the environment. They're finally trying to understand just how severe the situation we're in is. Another thing for Long Islanders in particular that I'm very pleased to see is more folks becoming more interested in anti-racist work and anti-racist legislation and really trying to learn what that looks like. I think, George Floyd changed that for many people. And I think a person who was maybe apolitical before coming into this space will immediately go to police reform, which of course is crucial. But when we do tend to get a lot of folks coming to our campaign from, that came to the space from the murder of George Floyd and Black Lives Matter protests. One of the things we really try to emphasize is how many structures, whether, to Skyler's point, whether it's education, it's housing, it's healthcare, it is all integrated, and all the policies that we are advocating for are really to rebalance equity, right? So when I think of Medicare for All, it's an anti-racist issue. When I think about funding education, the federal government only funds education about 8%, right? So we need to increase that. That is anti-racist legislation. Ending homelessness, it's anti-racist legislation. So, but ultimately, voters are seemingly more engaged. I think all the talk about redistricting right now, which is of course critical, I'm hearing a lot of voters very concerned about that, which is, I think fueling passing, For the People Act and, voting rights and making sure that, these predominantly Republican House legislatures are not going to be gerrymandering districts so badly that we won't be able to win the House for, probably decades.
Thank you for that, Melanie. And you actually anticipated the next question, which had to do with how we overcome systemic racism in our district, and of course in the country as a representative in Congress that you would be, and on Long Island. So you've just mentioned a number of key things that need to happen. So Skyler, I'll ask you to weigh in on that. How do you see, what specific legislation or initiatives do you see you can help implement to overcome systemic racism as a candidate and as a representative?
Well, so first of all, one of the things I do love about my candidacy here too is that I would be one of the few minority legislators on the island. We unfortunately do not have enough. We're a very, very diverse island, and we have only a few minority legislators, and that's something that I would like to see changed, both in my candidacy and others. part of there's several things that have to happen. Something that I can't directly influence, but I would like to see happen is, since this is a redistricting year, I would like to see more power given back to minority communities. If you look even at the maps for where I am, a lot of times those communities have been drawn to be just outside where they're going to have the most influence. You can make districts 1, 2, 3, and 4 all at least 33% minority. You can really change the representation of these areas. And unfortunately, the people who drew the last maps, you can tell that they didn't want to do that because it had to be unfortunately, we didn't have supermajorities in both chambers. So that will hopefully change this year. But when it comes to policy, there's a lot of things that really need to happen. It's a lot of the things I was just even talking about. For example, I was referring to education before and the ridiculous way of funding them through property tax. If you change that, you will largely benefit minority communities, because minority communities have been redlined into oblivion. You know, if people don't know the history there, during the age of the New Deal, there were a lot of groups that really did not want to see minorities succeed. So when community lines were being drawn, and when banks were coming to existence, they began a process called redlining, where specifically with banks, they would draw areas that had large groups of minorities, of segregated minorities, and they would say, if you live within this area, you will be pre-denied for a loan. And they said, if you live within the green area, then you will probably be approved for a loan. What that meant is that more businesses opened up in the green areas that were the white areas. People were able to grow their wealth in those areas, while at the exact same time, minority communities were flailing because they couldn't get any kind of real assistance to actually grow and were actually being held down by systemic racist policy. So that redlining has now extended to our education system, where we've seen those communities are now the same communities that are unfortunately being screwed over when it comes to funding of education. Those are the communities that are now poor and are now kind of caught into a vicious cycle, because as minority communities have been intentionally held down, they do not have properly funded schools, and they do not have then the resources to help to pull their communities out of those issues. And it's really, really disturbing to watch. So that is one of those policies that would really change, that would really help minority communities. And there's a lot. Again, it's the public transportation issue. It's changing our entire attitude on policing, which, by the way, I have seen such an increase in the amount of people talking about that. It is wonderful to watch, actually, because I cannot tell you how many people I've spoken to that identify police brutality as one of their top issues now. It is very, very different than it was even just a year ago, and I'm very happy to see that and people waking up to those issues. And it's something that I continue to push. But it's more than just the direct influence of policing. It comes to the funding of social programs, the funding of people who can reach out into these communities and help to reverse the racist policies of the past. It's ending the war on drugs. That is really just a war on Black people. It is so many policies that I cannot even begin to articulate, because every one of these policies is anti-racist. Every one of these policies ties directly into the harm that has been done to Black and brown communities. And I want to see that harm undone. I want to see that harm repaired, and I want to see us rebuilding these communities going forward. The other thing, too, that's really important in my campaign is reaching out into those minority communities and making sure that, first of all, we help them register to vote, but that we also overcome those barriers that have been placed. We've seen those issues with voting sites being closed, with lack of information in their areas, and a lot of time candidates kind of make the very dismissive statements that, well, those areas don't vote, so they never even reach out to them. That is something I will never do. I go into those communities that have been held down and that have been kept out of the discussion, and I make sure to have a conversation with them, and so many of them really appreciate it. You know, a friend of mine actually constantly rides the bus and registers people to vote, just because a lot of those people never had that opportunity, and we're really seeing things change. So both on the campaign level and the policy level, there is so much that we can do to really overcome systemic racism.
Thank you, Skyler, and thank you, Melanie. Wonderful responses, and there is a sea change that's happening, but it is building slowly on Long Island, partly due to the gerrymandering of the districts. So there's a lot that we wanted to cover, and we're going to have to jettison some of the questions. But since we're right where we are at this moment, I just wanted to ask each of you if you could comment on the biggest challenges we're facing to pass effective criminal justice reform. We just had less is more signed into law, which was a wonderful success, but a lot of other legislation did not make it this past go round in the state house. So Melanie, maybe you could start first, and then really asking you both to keep it really brief, because a lot of the issues will be addressed in the next round of questions that Catherine Levy will have. So thank you.
Sure. So I'm going to be really blunt on this question and say that many of our representatives are cowards. And it really is as simple as that. They are so fearful of the propaganda machine that will be thrown their way that it prevents them from doing the right thing. That's one piece of it. The second piece of it is that PBAs have become very powerful lobbying agents, and they are funding, the campaigns of those who back the blue, or so whatever that means these days, or support the police. And I think, I think a lot as a candidate about what's uniquely American, and maybe sometimes uniquely unique to New Yorkers. And there's this need to self-select into a team, and what I see sometimes is that it's become about being on the winning team, and it has nothing to do with actually solving any problems or, bringing solutions to the table. And that's really unfortunate. But I think, today, Senator Cory Booker, unfortunately, let the world know that negotiations have stalled in Congress with regards to police reform. It's so disheartening to see that. I do think Senator Booker really does care about police reform. I know he's pledged to continue to negotiate and go back at it. But at the end of the day, there has to be a standard of conduct. And I'm a huge supporter of ending qualified immunity. I think that needs to be a cornerstone of this legislation, and it cannot be negotiated out. So I would rather see the bill not go through than to exclude that piece of it. We have to keep the pressure on. I think they try to stall legislation sometimes when they don't want to pass it, which I think is what we've really seen, at least on the federal level with regards to police reform. But I think it comes down to just, not having the political will or the political courage to get things done. I don't want to step on Skyler's toes and talk about efforts on the state level, but just a very quick story. We all saw what happened in the last elections with regards to something as simple as bail reform. I recently was having a conversation with a state senator from New York City, and I said to him, I don't quite understand why Democrats hid from that. They should have stood in their truth and said, this is the most important civil rights legislation we've passed in X amount of years. And for some reason, they're so afraid of losing their seat that it precludes them from doing the right thing. And frankly, it doesn't serve any of us, when we have representatives like that, which is why I'm very happy to be running, and happy to be running with folks like Skyler, who I know, has a strong moral compass and is going to do the right thing above any outside pressure.
So I'm gonna try to keep this brief, because as I could talk a lot about this, but first of all, I do want to talk about a little bit of history here, because part of this is education too. So after the end of formal slavery in the United States, there were a lot of people that were very, very angry and wanted to see these policies continue. The criminal justice system did not exist in its current form until the 1860s and 1870s. So when Black people were freed as slaves, they started to build new jails, and they started to pass new laws that specifically targeted Black people. And when those Black people were arrested, guess what the constitutional amendment that abolished slavery said? That slavery was illegal except in cases of punishment, which meant that those Black people were pulled off the streets and put right back into forced labor. That's how it began. And we saw it evolve in so many different ways, where you saw the people who had previously been known as slave catchers, trying to maintain relevancy, stopped being called slave catchers and started to be called sheriffs. And we have seen, unfortunately, an entire criminal justice system that is fully based on white supremacy. And that that is actually that's actually the biggest challenge here, that we're trying to basically rebuild an entire system. But that's part of the reason education is so important. Most people don't know this. Most people aren't aware of the racist history of our criminal justice system. So when we're able to speak to people and make them understand how it started, it's able to make changes. But just as Melanie said, I would say that the greatest challenge right now to criminal justice reform is the PBA. Their power is absolutely ridiculous, and we will see the lengths that they will go to try to elect their candidates. You know, a lot of you probably know Jesse Warren in Southampton. He is not friends with the PBA. The PBA, in fact, actually threatened him because he put up a sign in his private business that said Black Lives Matter, and they got mad and told him that it meant he hated the police, and they did a no confidence vote on him because of it. They have unfortunately go to any lengths to eliminate the people that they see as enemies. They spent tens of thousands of dollars trying to unseat him, and they did fail in that. But we've seen it throughout the state, we've seen it throughout the county, we've seen it locally, that the PBA will go to any lengths to try to eliminate the people that they perceive as enemies. I am not afraid of the PBA, nor will I ever accept help from the PBA, because, and that's a pledge that I made a long time ago. I will never accept PBA funds, and I will never back down to them. They exist largely because people are scared of them. They exist largely because they think that if they just raise their voices, that everyone will cower, and that is something that I will never do. And it's part of the reason I can be effective in Albany. I'm not afraid that they're going to come after me. I know they're going to come after me. It's a bygone conclusion there, that I am always going to be, that they will always see me as a threat, because I will not back down for them. They unfortunately have so much influence over our legislators that we are not seeing any real legislative progress made, which is why we need really drastic campaign finance reform. Once we pull their money out of politics, legislation will change, because legislators will no longer be afraid of losing the money that is keeping them in office. That's why I will never take it now, because I will never be afraid of losing something that I am not getting. So there's a number of things here, and it's not a simple issue, nor is it an issue that can be broken down with just within this conversation. We could have hours-long panels on this, as you all well know. But I will say that our top obstacle right now to making drastic reform is the PBA. We have taken a lot of steps. As a lot of you know, Measure 50A from the New York Civil Code was a measure that allowed police to hide any misbehavior in their personnel files where it could not be accessed. We were able to change that. We were able to get that measure repealed last year, and it's a really, really great thing. And it's something that we need to make sure we're continuously making progress on and protecting against, because measures like 50A, things like qualified immunity, stop any real accountability. When we change these measures, we change the entire attitude around policing.
Thank you both. And you know, we just discussed the crucible of the campaign and almost every campaign in history, which is race and racism. And once again, you're going to be encountering in your campaign people who are, you know, against critical race theory, people who support the PBA. So I'm going to toss it back to Catherine Levy, who's now going to talk about campaigns and maybe how you're going to be able to overcome what you're going to have thrown at you in your campaigns. So thank you both.
You're muted, Catherine.
I'm so excited listening to the two of you. I could listen to you for hours. And at the same time, I'm frustrated because, as everybody on this call knows, I presume, progressives do not have a great track record on Long Island. So, you know, this is something I have discussed with Melanie in a different context. What do you think the greatest challenges or obstacles facing progressive candidates winning on Long Island are? What do you see as strategies to overcome that? And how are you constrained by the difficulties involved with COVID in the current campaign? And I'll start with Melanie.
Well, I think, you know, the most obvious issue is that we don't have a long history of progressive infrastructure on Long Island. Thankfully, it has grown rapidly, like Catherine said earlier, in the last 5 or 6 years. I'm so happy and excited and continually thrilled to learn of new grassroots groups that are continuing to pop up. There's over 100 on Long Island just in the last 5-6 years alone. And so we know that it's out there, right? We know that there is an appetite for change. We know that there's a willingness to change. But we're not well funded, unfortunately. The unfortunate reality is that without public financing, it is very difficult to get a campaign off the ground. There are folks who think, oh, well, people just donate, and the money doesn't just come. It takes a lot of hours, making these grueling phone calls, asking, your friends of friends, your family, people you haven't talked to in 30 years out of the blue, calling them and asking to fund your campaign. Because everything costs money. It costs money to hire people. It costs money to, purchase palm cards, and mailers are astronomically expensive. It can cost, upwards of $70,000 or $80,000 to do one mailer in a congressional district. So, we don't. I will say that on Long Island, what the Democratic Party has going for it is not so much the organizing, because we are actually doing much better on the progressive side with knocking doors and doing that, voter to voter outreach, that type of contact. We're much better than the establishment here on Long Island, but they have a funding mechanism. When they put up a candidate, they all donate and fund that candidate, whether that candidate is amazing or terrible. They'll fund them just the same, and that is unfortunately a huge barrier to to our success. Now, I am not someone who believes that that's the only factor. I do think that we need people to pay attention, and I think that we are trending in the right direction as progressives. Groups like Peer and many others. We've trained our group members in petitioning. We've trained them in canvassing. We've trained them in phone banking. We need people to do more. We need people to participate in democracy, and we can do it. So I definitely think there are paths forward, but it does require time. It does require investment. Unfortunately, it requires money. That to me, I see as one of the biggest detriments. I know, Catherine, you and I had worked on an initiative to better organize the organizers, right? So we're not being duplicative in our efforts, and that we're really leveraging each group's strength to, whether it's an issue or, there's some sort of policy advocacy that we need to do. We don't each have to do our own at home. We can rely on each other and share and use our time more efficiently. So, I think we're a little bit of a work in progress, but I think the momentum is on our side. The morality is on our side. The human rights piece is on our side. To Skyler's point where he said he knows the PBA is going to come after him. And this is true of all of the big lobbyist industries. They're going to come at you, and they're going to throw whatever sticks at you. It doesn't matter. But at the end of the day, if we can stand true to who we are and true to our values, it doesn't matter what they say, because we're nowhere on the right side of history, right? So I do think I'm very excited about the energy. And sometimes I think change can take longer than we would like it to, but the more we have progressives stepping up and running and talking and educating people, it's happening like popcorn. As I keep saying, I'm very excited to be running with Skyler and Joe Sackman, and there's a lot of great Queens candidates. You think about Queens 10 years ago. What is happening in Queens today is incredible. It is incredible. So much progressive energy. One of my dear friends, she's the co-executive director of the New Virginia Majority, who is largely credited with turning Virginia blue and keeping Virginia blue. She always says, no place is unflippable forever. And I believe that is true, whether you're flipping the seat red to blue, or, purple to blue, or blue to very blue. I believe that is very true. And so it's the hard work, it's the hard work that we're all doing that I think will really tip the scales. And it absolutely can. There are many places on Long Island that, are rarely canvassed. My congressional district, for example, has an extremely low voter turnout. Notwithstanding the last primary, because that was obviously very atypical with COVID and the primary being moved, the presidential primary being moved to the same day, and voter turnout was much larger. But in 2016, which was the last competitive primary in my district, only a little over 20,000 voters showed up. that's an incredible opportunity for progressives to get out the vote, which is really our strength. We have motivated voters. So to me, I think, we need to do a better job of getting people excited to invest in primaries, because to me, I believe that's where the real change happens, right? The Democrats are going to come out and vote on election day in the general election, but what that Democrat is going to look like and which policies that Democrat is going to support is ultimately going to be determined in the primary. So I do think we need to really push that and hammer that home, and really highlight the importance of investing early in a campaign. And by investing, I mean, whether that's donating, whether that's volunteering to do a task, it's voter outreach, it's volunteer outreach, whatever it is, we need to get involved early. We need to do a better job of that. Regarding COVID, I will tell you, having run a primary, and really New York was pretty much the first state that really had to campaign in its final days during the pandemic. So many other congressional candidates were looking toward us and asking us for advice in how we navigated it. And I think there was so much uncertainty that it was frankly very challenging. I think we did the best we could, but it was challenging. I think this time around, many of us now know how to navigate a pandemic, right? Life isn't completely back to normal, but we know how to do things. Even when cases are on the rise, we now know what the protocols are for safe canvassing. So I think, removing that uncertainty is really going to help us. And again, I think it's a strength for, the progressives, because we're the doers, we're the knockers, we're the ones that knock. And I think we're the ones that are motivated to get out there. So I'm not looking at COVID as much of a barrier to change as we did in the last election.
I want you to know that 2 people have donated in the course of this conversation. So it's what the Sunrise Movement always wants to happen in their conversations. There's 3.
Thank you.
Real action in the course of the conversations. Skyler, can you add to that about what we should do? What you think the biggest obstacles are and what your strategy is for overcoming them?
Yes, of course. So first of all, just like Melanie was talking about, fundraising is always a big issue. And Melanie, I got to say, you have done a really great job of that. I was impressed, especially by your day one numbers. It's really, really impressive what you were able to do. But as a candidate, I also know that while it may seem like a lot, it's never enough. You're always running against the machine, and that is actually the biggest issue for any candidate, for any Democratic candidate, but especially progressive candidates. On the Republican side, for example, you're always dealing with opponents that are funded by corporations, by super PACs, by people with extremely large coffers who can just throw thousands after thousands and thousands of dollars at them. And it's really, really devastating to watch, because as you're being a candidate for the people, you're watching your opponent be a candidate for corporate interest. I can say that this campaign has been really, really successful at fundraising so far, and I'm really, really optimistic about where we're going to go going forward. I have already raised over $22,000 for this cycle with over a year to go. That's the fastest a candidate, I believe, has raised for the seat ever, at least on the Democratic side. We actually outraised my GOP opponent for the first quarter. We were able to beat her in fundraising, and I believe that we'll continue to do so. I've seen a lot of really great success from fundraising, and I'm really looking forward, like I said, to that continuing. But it's difficult, and that's why I really appreciate everyone who's donated tonight or has in the past. It is really, really helpful and really, really instrumental in running a continuing campaign, because everything is so expensive. And again, as the race gets closer, we're going to see more special interests get involved for my opponent. So we need to make sure that we're able to counter that. The other issue that I have, which is unique to state races, is this, and it's something I saw in both the state Senate and state assembly campaigns. People don't really know what we're doing. When I ran for state Senate, we would send out text messages for text banking. And a lot of times the response that we would get is, "Oh, I'm sorry, I'm already voting for Nancy Goroff." Okay, that's great. Nancy's running for Congress. I'm running for state Senate. That's not those two things aren't in conflict. And it's something that we've seen in the assembly too. I'll be on the phone with someone and I will go, "Oh, I'm running for New York State Assembly District 2." And they'll say, "Oh, are you running against Lee Zeldin?" And I'll always say, "No, I would love to get rid of Lee Zeldin too, but that's not what I'm running for. And that's not their fault. That's a failure of our entire educational system to properly educate people on civic values. So the thing that is actually probably the biggest obstacle in our campaign is just getting people to pay attention and know what the assembly is. And unfortunately, I will say that's something that really pains me, is that a lot of times, even when people know what the assembly is, they don't really care as part of the issue. And that is why I love things like this, because it highlights why it's so important, because people don't realize the state legislator has so much direct influence over their life. If you've read the Constitution, you know that it says that if a power has not been delegated to the federal government, it falls to the states, which means that the states have so much influence over our lives, and we need to be putting a lot more influence on the state legislators. There's unfortunately not a lot of dedication to maintaining and getting good representatives in the state legislature, and that's something that I'm looking to change. So it starts a lot of times with educating people on exactly what the state assembly is, what our job is, what I can do if I win, but also getting people to understand why it's just as important as voting for seats like Congress is voting for the United States Senate. We have so much that we can do. We have so much that we can change. And that is really my biggest challenge, making sure to get the word out about the campaign in a way that people understand what I'm asking them to vote for.
Yeah, I mean, let's all remember that AOC had incredible volunteer help. She didn't have much money. She didn't have name recognition. She was running against somebody who was positioning himself to become the next Speaker of the House. So, and I think you two are as great candidates as AOC was. And maybe Melanie could form the real problem solvers caucus in the House. I would like both of you to drop links into the chat for people to volunteer, to canvass, text, fundraise, everything. And while you're doing that, does anyone have any audience questions? Jerry Maslanka will be fielding them.
Okay, hi everybody. Boy, this has been great. I don't think Ava's with us any longer. She had a question and it goes back to the New York Health Act. And well, Melanie, of course, you're looking at a national race, but Skyler, maybe you can respond to this. And it has to do with why the, sorry about that. Okay. Can you give a response to why the New York Health Act was not brought up for a vote last session? As I said, you guys aren't in office, so you're not intimately involved with that, but you may have networks, you may have an opinions or some kind of information related to that.
I can't, of course, I can't speak for the speaker. I can't tell you what was going on inside leadership there that made that decision. But here's my guess. New York Health Act was introduced with majority support in both legislators. It would have passed if it was voted on. I think that there were a couple of things that happened there. First of all, that was before Governor Cuomo's resignation. He had made it very, very clear in the past that he did not want to have to sign. He did not want to have to sign or veto New York Health Act. He did not want to be seen as the person that killed that. And in fact, actually, that is part of the reason why there have been reports that during the last race, so if some of you didn't know, right before the election in 2020, there was a sudden influx of money to Republican candidates. It has been reported on that the reason that influx of money came is because Cuomo called his donors and said, I do not want a supermajority in the state Senate to defeat these candidates. So unfortunately, we saw the previous governor make every effort to try to prevent the supermajority that could pass New York Health Act from getting elected. So I do think that that's part of it. It's because unfortunately Cuomo most likely exerted his influence to stop it from being voted on. But I also think that part of the issue, and something that I think is big in this discussion, it gets left out, is that passing New York Health Act is more than just getting the votes and getting it through the legislator. It's having an effective PR strategy and an effective outreach strategy. And that's something I've discussed a lot. Republicans are really, really great at messaging. Republicans, unfortunately, tend to know exactly what to say to just stir up trouble and to get people really, really mad. Democrats, on the other hand, are not always the best with that. We saw this with bail reform. Unfortunately, when bail reform was announced, there was really no PR strategy that was associated with this. So the GOP latched on, they grabbed it, and they ran with whatever they wanted to say, no matter how false it was. So something that I advocate for is not just passing the New York Health Act, it's putting an effective outreach strategy in place to allow people to understand what it actually means. And I know a lot about the New York Health Act, so that is something that means a lot to me, because I understand why it's such a good bill, but most people don't. Most people don't know what it is, as I've said before. So I do think that part of the hesitancy to pass it was the fear that whatever the GOP threw at them would then cause them trouble in the next election cycles, which is not an excuse, because we need to be putting people over their own seats. We need to make sure that we are always prioritizing what's best for the state. But so if I was there, besides the fact that, believe me, I would be having words about the fact that we had not even voted on an act that was introduced with majority support. I would make sure that we were putting in place proper strategies to actually convey this to everyone in the state, so that way it could be understood what this program was, how it was going to work, and to lower those fear responses. And I think that those are kind of some of the big reasons why it wasn't voted on. And both of those things can be rectified. First of all, we no longer have Cuomo in office. We have a new governor who hopefully will see the reason why New York Health Act is so important. But even if she doesn't directly, we can make that happen by grassroots organizing, by pressuring, by making sure that the legislator at least takes a vote. I was so disappointed that the legislator did not vote on a bill that, again, would have passed, because it already had majority co-sponsors. I don't have a crystal ball. I can't speak for them, but those would be my assumptions about why it was not voted on.
Mhm.
I'd like to add something, if that's okay, Jerry.
Yeah.
And this is, I'll speak a little bit on the state, but we see this all too often on the federal level as well. And it's what I have heard from some of my connections in the state. And this is, of course, not a blanket, but for a blanket reason, but for at least a percentage of members. One thing that tends to happen in politics is that politicians will support a piece of legislation when they know it has no chance of passing, so that they can, cover their behinds with their constituents or with certain groups. So they can walk into a room and say, well, I supported the New York Health Act. It's everyone else. They're not voting for it. I'm doing what I can. And it appeases groups. And then he'll walk into another group and oh, well, it's never going to pass. So don't worry. It's a lot of political games and posturing. We're seeing this in the federal government. I'm sure you are all familiar with the legislation on lowering prescription drugs. And, Kathleen Rice had run on doing just that and based her whole campaign on it, and then was a no vote. And I think she's gotten something like $80,000 from pharma. My opponent initially, when he first ran for Congress, said that he would be a yes on Medicare for all and backed away from it. He also tried to gut the HR 3, which is lowering prescription drugs, with a Republican bill that happened quietly and no one knows about that either. So when politicians get out and they tell us, well, I support this, I'm a champion for healthcare, it's really important that we, peel that onion back, because we can't just take them all at their at face value. And, that's why I'm really grateful for groups like you that hold these informative forums where we can really dig into the details. I think it's really important that we elect grassroots candidates that come from, the grassroots organizing communities, because we know what their true colors are, and we know what they're going to be, and we know we can count on them. But unfortunately, this has been a real problem. And when we aren't paying attention, they get away with it. So part of it is holding them accountable and really paying attention to what they're doing.
Yeah. So I have no other questions in the chat. If anybody wants to put up their hand, I sort of have. Catherine, what?
Catherine Soka had a question, I believe.
I'm sorry, who?
Catherine Soka.
Oh, oh, her. Yes, Catherine, go ahead.
Yes, thank you. My question is very simple, but I think it's one way that we can multiply the effect of our activism, and that is how you may need surrogates to go to other locations like small business groups that Melanie mentioned, maybe unions, and the New York Health group on Long Island has developed a terrific New York Health Act presentation that has gone around. So it would be kind of a natural next step to not only go around and talk about the New York Health Act, but also do it under the auspices of talking about your campaign. So I just want to know, how could people, if they want to be a surrogate for your campaign, reach out to you to do that if you are interested?
I'm definitely interested. I put in the chat the volunteer form. So if anyone is interested in even making an introduction, we do have a field where you can add, what you're interested in doing. So that would be really helpful for us. We're trying to, as I said, we're very thankful that we built such a strong coalition in the last campaign that has been with us and came back to us on day one, but we're trying to really expand that and not take a single day for granted. So if you think you have a connection, whether it's to a union, Small Business Administration, or even an organization, I would be very grateful for the opportunity to be, for an introduction or whatever.
I'm sorry, Catherine. Would you mind just repeating the last part of what you said? I missed part of what you said at the end.
Well, wondering if you have a need for surrogates to be able to go around to different groups in your district to basically promote your positions, and again, on a position-oriented basis, and obviously then your candidacy.
I do have to say, I am lucky enough to have a good relationship with most of the groups within my area, but I could always use that help both inside and outside of groups, because as I said before, people don't pay much attention to the assembly. We have such low, unfortunately, the rates of engagement are so much lower, and it's not as natural as it is for higher offices. So I do need people who can advocate that, just to pay attention to this campaign. So whenever you're talking to anyone who could have any kind of vested stake in this race, I would love if you could just bring up my name, direct them to my website, just tell them anything, because it really, really benefits us, because people aren't as directly engaged as they are with some other seats. So if you could just say, hey, he's running for assembly, he can really make a difference in our state, that really helps. So I can't tell you how much word of mouth organizing has really benefited us. I've had so many people reach out or donate or sign up to volunteer just because they heard about us from a friend. So if you can talk to anyone especially inside the district about this, it would be really helpful, especially because since it's a redistricting year, we could end up with part of Southampton. I doubt it would be a big chunk, but we could end up with some of you in the district or some of your friends in the district. So it's really beneficial for us if you can just share the word about my campaign and about what we're trying to do here.
Great. And we definitely will. Friend to friend is a very potent and powerful way to get the word out. And if each of us reaches out to 4 people, we'll have 100 people who are potential donors and helpers. So Jerry, back to you. I think there may be some other questions.
Yeah, there are. Joe Sackman has a question about the border and immigration, I guess. Go ahead, Joe.
Thanks, Jerry. I guess this is more for Melanie. So as we're seeing some of the horrific actions by ICE and Border Patrol with Haitian refugees, especially in Texas, looks like a humanitarian crisis. The Biden administration has fought to keep a Trump-era immigration policy, Title 42. And so denying refugee status to the Haitians who are coming through. And I know Melanie's been to the border, et cetera, and visited the camps that we have down there. Where is your stance on this, and what should we do, and can we hold the Biden administration accountable for it?
Yes, thank you, Joe. You bring up a really interesting point in the sense that, we were all very critical of Donald Trump with his horrific actions taken and really just torture of undocumented people at the border. There were marches, there were rallies, there was, closing down ICE. I did participate in a lot of them, and I know there's always a lot happening in the news cycle, but I almost couldn't believe, I don't know why I'm still shocked, but I am, the pictures of the horseback and what was happening is absolutely horrific. And I am a big proponent of amnesty and allowing folks come and apply for asylum. As you mentioned, I've been to the border. I did some humanitarian aid work there. Most of us, unless we have indigenous blood, we all are the descendants of immigrants who came here. And my great grandmother immigrated over from Ireland, and I just think she must be turning over in her grave, seeing what's happening these days. So I am a huge proponent of, in terms of immigration. I'm not an expert in the area, but I do center a dignified and just path to citizenship for folks coming over. Certainly, DACA recipients, individuals with TPS, essential workers, which I think is something that we're not talking enough about. Essential workers kept us going for, so many months and really saved this country during the pandemic at great risk. And I think the very least we can do is supply a path to citizenship. But with regards to, Haitian immigrants coming over, there is a little bit of a swell in particularly one border town. I would like to see us actually work in good faith effort to come to a solution where we do have a process, because we need a process, but it needs to be humane, it needs to be dignified. And what we saw this week, it is none of that. And frankly, and I think probably many of us would agree on this call, the evolution of ICE and Customs and Border Patrol is so bastardized from its initial inception that it's basically a rogue agency that embodies everything wrong with America. So I've always been in favor of, closing the camps, but also abolishing, at the very least, the ERO division of ICE. I'd be happy to abolish it altogether. But I think if we are the country that welcomes thy stranger, then we need to do that and provide people a real ladder for opportunity.
Okay, Francesca has a question for Skyler on the CCIA.
So I want to make sure I advocate for the Climate and Community Investment Act. It's really, really important.
Skyler, just a moment. Let's let Francesca ask her question.
Sure.
Okay. Francesca, be sure to unmute yourself. We're not hearing you. Oh, I'm sorry.
Can you write it, Francesca?
Yeah.
Just write it.
Put it in the chat. Oh.
And maybe, or maybe just ask Skyler to talk about the CCIA, which.
Yeah, why don't you go ahead and begin, Skyler, sorry. And we'll see what Francesca asks.
Yeah, absolutely. So the Climate Community Investment Act. So I'll talk about first of all how I would advocate for it. So the CCIA is really important too because it also holds polluters accountable, which is something that both I and Melanie mentioned. Melanie, I was really glad that you said that too, because it's such an important part. It's such an important aspect here. We recently saw the pollution by Grumman on the island, and we saw the devastating effects of that with the Grumman plume and everything that came out of it. And we unfortunately don't see corporations held accountable nor paying their fair share to actually make sure they're doing actually change things here. So with the CCIA, it would make sure that we're holding these corporations accountable, and it would help to fund these efforts. I can tell you, I can't necessarily honestly speak as much to what happened to the act. I can just tell you how I would advocate for it. It's something that I would incorporate into my campaign and into my tenure in Albany, because it's already basically what I'm saying, to be quite honest. It's already a piece of everything that I'm talking about. It's part of a much larger picture. We need to be making sure that we're holding corporations accountable when they're polluting our environment. I believe I'm trying to remember the exact numbers, but it was something along the lines of that 10 companies are responsible for 70% of our pollution or something like that. It is a ridiculous number where only a few major corporations are really responsible for the majority of the damage that is being done to our earth. And while I'm not running for a federal position where I can affect that for what they're doing everywhere else, I could say that if I'm in office, I'm going to make sure that when they harm New York's environment, we're going to be holding them accountable, and we're going to be reinvesting that money into into our environment. We're going to making sure that we're putting it into cleaner, greener infrastructure, which is also part of the bill, because an aspect of the CCIA is to create better, clean jobs, to create green jobs, and that's part of where the investment into clean energy comes in. We constantly hear in the discussion when talking about eliminating reliance on fossil fuel about the fear of losing those jobs. Well, if we reinvent those jobs into jobs about clean energy, into electricity, into wind power, into all of these clean and really, really great sources of power, we're going to not only be creating more jobs, we're going to be creating cleaner jobs, and it really benefits everyone. So for the CCIA, I will always continue to be an advocate for it, both by name, but also just in the aspects of it that I'm trying to introduce in Albany. Even if that specific act isn't passing, I'm going to be making sure that we're taking every aspect of it that needs to get through, which is all of it, and making sure that it does get done, because it is critical. Climate change is an existential threat, and we need to make sure that we are passing it, that we need to make sure we're doing everything we can to fight against it.
Would you mind if I just added a little on this? I know I wasn't as a candidate. It is state level legislation. As a community member, I did a lot of advocacy and lobbying for the CCIA. I held panels in my neighborhood to try to educate people. It's my understanding that at least with the Long Island representatives, and I don't know if this is the truth or this is an excuse, because we know the lobbying around climate is really it's really intense, but the issue of increasing gas prices was an issue for at least the issue that I heard from the most senators on Long Island. There were subsidies, but the way, we all know, we all live here on Long Island, the cost of living is extremely high. And even though there are maybe salaries that in other parts of the country, we'd be, considered pretty wealthy, here, folks are living paycheck to paycheck, and they wouldn't have qualified for those subsidies. So I know that was a concern. I don't think it was a big enough concern to scrap the bill together. That's what negotiations are for. I do think we do need to accelerate a transition away from oil and gas. But, to Skyler's point, you'll hear a lot of talk about electric cars, and that's really a stopgap solution. What we need to be focused federally on is creating a green transportation system and building it out. And that is really where we need to move in as quickly as possible. And unfortunately, we have seen politicians kick the can on climate change down the road so long that there's no more road left. It's not just big oil or gas that's causing global warming, but it's also in a major way, and we're shifting, and we have to pay attention to this, because you're seeing oil companies shift away from actually burning oil, and they're now processing plastic, which is a horrific has a horrific impact on global warming. So, I would like to see, and we don't see this really at all, at least in our region in New York, we don't see the federal government being a good partner to our state level legislators. And I really do think that there is plenty of key legislation where we can work together and fight and educate our communities. And that's something that I do plan to do once I'm in office, and find good partners like Skyler to further those messages and see how we can really make the impact that we need, that's actually measurable and meaningful.
Great. I think no more questions. How are we on time, Catherine? I have a question sort of off on a whole totally different topic. If we have time.
Well, we're running over, but let's do one last question, and we'll do like a short answer, but please.
Well, it's more specifically to Skyler. I'm just curious, because there was a hearing this week on the Board of Elections. They were holding hearings regarding reform and legislation, and Liz Kruger's bill was sort of featured. She has a bill that's there to do some reforms to the Board of Elections, and I'm just wondering if you had a chance to listen in on any of that, and if you have any thoughts. So this is just kind of out of left field.
No. So I unfortunately haven't had a chance to see these hearings, but we do need to see reform for the Board of Elections, and I am familiar with that, with the legislation. I've seen there's been a lot of discussion in it, because right now, unfortunately, Board of Elections tends to act as a duly partisan organization, and it creates a lot of problems within our process. We also did see that within New York City about how the Board of Elections was not properly equipped to handle the changes in voting that came with it. And that's partially because Board of Elections tend to be underfunded. They tend to be understaffed. There's a lot of major issues with Board of Elections. And there's a lot of really big reforms that we can make. And it's really just about properly making sure that they're not hyper partisan, but also that they continue to have the proper funding. So I'll definitely check out the hearings. I haven't had a chance to tune into those, but I will definitely check that out. I'm glad you brought that up. Thank you.
Or look at Liz Kruger's bill and see what the Assembly bill, if there's a counterpart, to that. Thank you. Catherine, I guess that's it on the question.
Thank you, Jerry. Thank you. And thank you, Melanie. Thank you, Skyler. You are both such intelligent, passionate candidates. We are going to help put you, Melanie, down in Washington, Skyler up in Albany. And that's our goal and our charge tonight for everybody who remains on the call. Get 4 friends, get them to help support these candidates, and each 4 to find 4 more. But I just wanted to close with a few announcements that dovetail with some of the discussion we just finished up with. Number 1, on climate. PEER's next meeting in October is going to have climate as our topic. The tentative date is the 26th of October. I just dropped that in the chat. And we're actually hoping, though she doesn't know it, to ask Francesca to join us on the panel. So hopefully she'll be available for that, along with a few other representatives to discuss climate and issues facing us on the climate. Also, essential workers. If Sigrid is still on the call and could unmute herself, I know that she had some information about how we can support essential workers, some announcements about that. Sigrid, are you with us?
I think she may be gone.
She may have gone. So basically, in a nutshell, I guess they are asking essential workers to apply through the New York Department of Labor for the money that was budgeted, although most of the $2.1 billion has already been allocated. And there will be a rally in Riverhead, October 16th, to support them. Find out more via social media, and we'll also send an email with that information going forward. And finally, 2 other announcements. PEER is working with East End EMB and Solidarity Sundays to try to work on affordable housing initiatives on the South Fork. If you're interested in joining those meetings, they're generally on Sunday. Just drop in the chat or send me an email, and I'll connect you to the people who are organizing that. So that's affordable housing. And finally, every Wednesday, including tonight, the Long Island New York Health Act Committee gathers to discuss how we can move forward to get this bill passed. If you're interested in working on the New York Health Act together with other Long Islanders, drop in the chat or send me an email about that. But I really cannot thank Melanie nor Skyler enough for your time and for your dedication. And I just keep hearing, ringing in my head, the statement about the moral imperative that we have to take care of everyone on the island, everyone on the earth, and the earth itself, and that's what motivates you, and it's wonderful and heartening to hear that. So, Catherine Levy, any final comments as the co-moderator?
Well, I often say to friends who are filled with despair about our politics and our society that they should listen in to some of my meetings with the great local activists. 2 of them are Skyler and Melanie, and I think that you've shown the world why I continue to be hopeful and inspired. This was an extraordinary meeting, and I just want to say to everybody on the call, you could host a meet and greet with these 2 candidates as well, because I think we need to get the word out that we have 2 of the most inspiring potential leaders in the country on this call, and we have to make sure that they get into office. They will change things and they will really solve problems. Thank you both so much.
Yes. Thank you. Thank you again. And we look forward to working with you on the campaign and when you're in office. So let's give them all a round of Zoom applause for their wonderful work and let them take the rest of the night off.
They're not going to do that.